डॉक्टर साहब, जो लोग पहले से आर्थराइटिस के मरीज हैं, उनके लिए कौन सा व्यायाम सुरक्षित है, इस बारे में हमें बताएं।
Basically, again, we are going to deal with arthritis in the stage where the patient has got that arthritis. So I'm going to talk basically about the knee arthritis and the hip arthritis. So whenever you meet your physician, he's definitely going to tell you the grade at which you are at in your arthritis. We generally tend to recommend low impact exercises such as walking, cycling, or swimming. So if you do not have access to swimming or cycling, walking is one of the best things that you can do on a flat surface. We do not recommend you to go above and beyond on stairs or something like that. Wear comfortable shoes and walk as far as you are comfortable. You should also avoid high strain exercises, which means going to the gym or something like that. Walking is the best that you can do in cases of low grade arthritis. Patients also tend to ask, if you undergo surgery or you are undergoing any kind of treatment, what effective rehabilitation strategies should you go for? So your treating surgeon is definitely going to tell you pre-op or post-op what kind of physiotherapy programs or any other structural activities that you need to undergo pre and post-op. So before you are going to undergo any surgery, the doctor is definitely going to tell you that you need to tone your muscles. For example, if you are going to undergo a total knee replacement, the doctor is definitely going to tell you to tone up your quadriceps and hamstrings. So if you are going to do that beforehand, your end results are going to be definitely much better than an obese patient who is not going to do any of these. Again, the doctor post-operatively is going to give you certain amount of exercises, and a physiotherapist also who is going to teach you how to cope up with this. Another element of surgery is your emotional support. So many of the patients before surgery, they are well motivated, but when they have the surgery and there is certain amount of pain involved, they tend to get demotivated. So the family support and other amounts of support that the other doctors are going to give you or your colleagues are going to give you is paramount, so that you do not get replaced. So most of the cases where you get knee replacement and hip replacement done, the doctor is going to make you stand up on day one. So that is a morale booster for the patient as well and the colleagues as well, that the surgery has been done and he's walking on day one. So that is paramount. Again, gradual return to daily activities is obviously recommended. Most of us, we work in multinational companies or something like that. Walking is allowed. When you're supposed to take steps, the affected knee or the hip that has been involved does not need to be loaded. So you need to take care that when you walk, you should load your other limb more than what you're going to load the current limb. Again, coming to the types of exercises that you can do, we can divide them into stretching, strengthening, and aerobic and anaerobic kind of exercises. So most of the cases when you have simple case of grade 1 or grade 2 arthritis of your knee or your hip, you start with simple stretching exercises, go on to walking, and then gradual stepping exercises which include your quadriceps and hamstring strengthening. So with these kind of basic exercises, I am specifically talking about lower limb exercises because they are the ones that are more loaded with the weight. Upper limbs such as shoulder and your elbows do not need that much rehabilitation before and after exercises because we tend to use them more. So again, coming back to the crux of the situation, we should again and again try more and more to be in optimal shape pre-op, and again before or after the surgery, we must make sure that we are going to do these exercises as well as we can.
डॉक्टर साहब, हम देखते हैं कि जागरूकता की कमी एक